It's always about innovation and trying to be on the forefront of what's going to happen next. So a lot of things that we did throughout the years with albuterol and Narcan and compression devices and so forth were all initiatives that started here at Cataldo Ambulance and were driven under special project waivers. And back in around 2011, 2012, there was some programs that had begun to take hold in other parts of the country that were referred to at the time as community paramedicine. And basically what they were, in a very simple form, was trying to find a way to get folks the help they needed, the clinical help that they needed, and the oversight that they needed, in lieu of using the emergency room as their primary care or their primary place of to obtain health care. So instead of transporting an individual, every 2 or 3 weeks because they couldn't take their insulin and they were diabetic, was, how do we go out and see them every 5 days and make sure they're taking their insulin so they don't call 911 at all. And we came back here and started to lay the groundwork for a program, our own community paramedic program, to be able to manage patients in different healthcare settings, but also manage patients that were part of a healthcare system that had accountability. And we approached the state of Massachusetts to establish these services under a special project waiver. So there was a lot that occurred over a very long period of time now, from about 2014 through 2017 or 18, ultimately resulted in Governor Baker promulgating the regulations for what became mobile integrated health. And so we were the first organization in the state of Massachusetts to be awarded a mobile integrated health contract. And we set forth under that umbrella, right, kind of timely with COVID, when patients needed to be cared for at home in lieu of in the hospital setting in many cases. And we've continued to invest in that programming, and now we operate what is probably the most widely recognized program, mobile integrated health program in the country. And we are actively working with many quality healthcare organizations to manage patients in the home. We saw over 10,000 patients last year, which was kind of our first full year of providing services. And that business has continued to grow, and the interest level in those services is, beyond what we ever imagined it would be. And we have, specially trained paramedics with non-transporting vehicles, sitting in patients' homes, administering all kinds of medications that they need, working directly with the patient's primary care physician, providing HIPAA compliant reporting, and reducing healthcare costs tenfold. And the results beyond that, and the most important results, are patient satisfaction. And the patients that we serve have never been more vocal about how beneficial the services have been to them and how satisfied they are with their ability to receive care in their home setting and the professionalism of the staff. And we're super proud to be the first in the state, and we think the best in the nation.